teledentistry, and is it right for your office today and in the future? One note, Dr. Peterson's video was pre-recorded, and I did provide a handout. I did see in the chat that there were maybe some issues with it, so email Joe Peterson in her emails in the chat box if you need that. One thing I noticed too, there's I think one broken link in there. It worked on Saturday when I made the document. It's the ADA Guide to Teledentistry Coding and Billing. If you Google that, you'll be able to find that. That's a really important document, so I'm sorry that the link is not working. But let's get into it. Some disclosures. I am a contracted provider with Oral Eye, which is the parent company of the Toothpick app, and I have been since 2017. And then I'm also a contracted provider with the Teledentists. And neither of these companies are paying me to speak about them. I only get paid when I do direct patient care. Our learning objectives tonight: what is teledentistry and how is it categorized? How is it currently being used in the United States? How you can implement teledentistry in the short term amidst this pandemic, which includes how to bill insurance, the necessary documentation in order to be reimbursed, informed consent, current legislation surrounding teledentistry, and what systems currently exist to help dentists get up and running. And then also we'll talk about how teledentistry may continue in the long term and become more of a norm in dentistry. Teledentistry is housed under the telemedicine category, and this is according to the Minnesota Department of Human Services. These are all of the specialties that are allowed to or eligible to provide telemedicine services. As you can see in the middle, dentists, hygienists, dental therapists, and ADTs are able to provide these services currently in Minnesota. Some other examples of some telemedicine services that I'm familiar with that I've actually used are Doctor on Demand, Virtuwell, MD Live. My insurance company provided me with that information. I was able to get in touch with my doctor. So there are a lot of examples of how that is already being used in our medicine. So according to the ADA, teledentistry is defined as the means for a patient to receive services when the patient is in one physical location and the dentist or the other healthcare practitioner is overseeing the delivery of those services in another location. This mode of patient care makes use of telecommunication technologies to convey health information and facilitate the delivery of dental services without the physical constraints of a brick-and-mortar dental office. Teledentistry is not new. The first documented use was in 1994 in the military. They did a supervised suture removal via intraoral photos, and afterwards they surveyed 15 patients. 14 of them were happy with the services. There was no post-op needed, and what they enjoyed was not having to travel back and forth between the forts, which was a long distance. And they were able to discuss the outcome with the periodontist that originally did the procedure. There's also another project by the Department of Defense in 1999 called Total Dental Access, where they used telemedicine services to connect to dental specialists. So like I said, it's not new, but it has reached its tipping point. This is an interesting look at how many search hits there have been on Google from March 2017 or February until the start of the pandemic. There's definitely been a spike of interest in this topic, which is probably why you're here with me tonight, besides getting the free continuing education credit. So interesting to see. The ADA categorizes teledentistry in 4 modalities. There's synchronous, which is live video, similar to what we're doing right now. Asynchronous, which is a store and forward method, remote patient monitoring, and mobile health. And I'll give you examples of all 4 of these. Synchronous, which I mentioned, live video, two-way interaction between a person and a provider using an audio-visual telecommunications technology. So an example is FaceTime or a Skype style on the computer. Asynchronous is the transmission of recorded health information like x-rays, photos, video, digital impressions through a communication system to a practitioner who then uses the information to evaluate a patient's condition or render a service outside of a real-time or live interaction. So what I've documented here is an allied dental personnel taking intraoral photos, x-rays, dental charting, perio probings, sending it most likely into their electronic dental record. The dentist is at another site, maybe another day, assessing the information, creating an evaluation, diagnosis, and a treatment plan, and sending it back to delegate what the next steps are. Remote patient monitoring is personal health and medical data collection from one individual via an electronic communication technology, which is then transmitted to a provider in a different area for the supportive care. This is considered a subcategory of synchronous or asynchronous delivery, so it doesn't have its own independent CDT code. Some dentists may be familiar with this at-home sleep apnea test, which monitors your heart rate, blood oxygen level, airflow, and breathing patterns, and then care is supported after that. Another example of this is the Holter monitor, which is a heart monitoring device used in medicine. Mobile health is healthcare and public health practice that is supported by mobile communication devices such as cell phones, tablets, and it is also a subcategory of synchronous or asynchronous delivery. So it again doesn't have its independent CDT code. It also can overlap with remote patient monitoring. In the dental world, one of the examples is the app PH2O. They say on their website, all you have to do is take a picture of your litmus paper strip, which the patient purchases from the company, and then the app does the work for you. The dental team then educates the patients and assists them in their preventive treatment planning and helps properly select the dental materials in order to initiate changes in the patient's oral hygiene. Another example, I actually saw this when I was in an Apple store a couple years ago. It piqued my interest. It's a Philips Sonicare FlexCare Platinum connected toothbrush. It connects via Bluetooth, and patients can generate an in-app report that summarizes their brushing over the past 30 days, and then email it if they choose to their dentist. It gives them touch-up areas, focus areas they may be missing, helps them set goals, and then tells them when their brush needs to be changed, the brush head. So we'll get into more specifics later on implementation and billing. I know there will be a lot of questions on that. I more so just want to show that these are the two billable modalities of teledentistry. They're not a specific service and it doesn't change your scope of practice. They're both reported in addition to other services such as a diagnostic exam that is delivered on the date of service. And these were implemented into the CDT codes in 2018. Our current goals and responsibilities as dental professionals amidst this crisis are to mitigate the COVID-19 spread, triage patients away from the emergency room, and preserve PPE. Obviously, just because we're mandated to stay at home, patients' pain is not going to stop. We're still going to have broken fillings and pain and children bumping their teeth and infections, but we do need to do our part. And I'm sure you've all seen this ADA's list of what constitutes a dental emergency. I think this is an important reference and list to have because what constitutes a dental emergency for a patient may differ from what we believe is an emergency that needs to be seen in the clinic. And I received this email last week from the Pew Research Institute. It's a survey that was done by the Health Policy Institute, and 19,000 dentists responded. It's interesting just to see the statistics across the country. 18% of dental clinics are closed and not seeing any patients. I hope that they're at least answering the phone. But early on in the crisis, I got an email from the Minnesota Dental Association that stated some patients were calling them or the board saying they've been calling their dentist and the phone's been ringing and ringing and they can't get through and they don't know where to go. So teledentistry might be a great option for clinics that are in that situation that felt they had to close their doors, whether it was due to lack of PPE or illness of their staff or themselves, loved ones. staffing or financial issues, not sure. But we really don't want to risk patient abandonment. We need to be able to support our patients through this. Within that survey, the Health Policy Institute asked dentists to consider what would happen if this crisis were to continue until the end of April, end of June, end of August, which obviously none of us want that to happen, but who knows. 20 to 25% said that they would want to find an innovative way to expand their patient base. How about teledentistry? Maybe you can attract new patients. There might be patients that suddenly have pain and they don't have a dental home. This obviously is not going to be the end all for financial gain and revenue. It's not going to replace revenue generating procedures like crowns and implants, but it may help sustain the practice a little bit. And we'll talk more later about how to get paid for it. And then another half of dentists said they would like to find innovative ways to lower their operating costs. We'll discuss this more too, but teledentistry may be able to help decrease some of the overhead. You will use less PPE, less staff time, less chair time. And that's going to be really precious once we get back to work. And then another majority said that they would borrow money in order to address financial shortfalls. Some of you may have already received the payroll protecting loan, and a lot of those say that you have to use that for payroll in the next 8 weeks. So if you're looking for something for your staff to do while you still can't do business as usual, having them train in teledentistry, having them help you get set up in teledentistry, helping you triage patients, all could be a possibility. It's unfortunate to see that 46% of dentists said they could not sustain their practice. That's unfortunate, and I hope that teledentistry could help. There are a lot of benefits, especially now when we don't want to overwhelm the ERs. It's important to offer services that can mitigate this issue and effectively triage patients. ADA's Health Policy Institute reported in 2012 that $1.6 billion were spent on dental-related emergency room visits, and that the majority of these could have been treated in a dental clinic. They did not need to be seen in the ER. Receiving prior information can allow dentists to reasonably predict treatment and accurately allocate staff, time, and materials for care, from an article in the Journal of California Dental Association. Knowing this, if you are seeing every patient that calls you for an urgent care, you're using more PPE than you need. Just think back to what constitutes a dental emergency for a patient. If temporary falls off on their molar, and they're not in pain, do we have to get it back on? It'd be great if we could, but maybe we could triage and say, maybe you go to CVS and get some temp on for now. We don't have to see you in the chair right now. And in doing this, you could then decrease your overhead costs by using less PPE, using less staff, etc. This also will help decrease exposure risk, because the more people you come in, the more risk you're putting yourself, your staff, and the patients at. It can also increase access to care. The Health Resources and Service Administration, or HRSA, reports that 59 million Americans are lacking basic dental care. This could be from lack of insurance, cost of treatment, transportation, mobility issues, or, as the ADA's Health Policy Institute reports, a shortage of dental professionals. There are 6,319 areas of the country that are designated professional shortage areas, which is huge. This also could help decrease anxiety or the white coat syndrome. If we started seeing new patients via video, patients think we're already scary. And when we start having to add on the amount of PPE we're going to be wearing because of this crisis, we're going to be even scarier. Like to this little kiddo in the picture, if you can imagine starting your visit with him via FaceTime without the PPE, you can get to know each other, you'll be smiling, he'll see how nice you are. And then when he comes back, or when he's scheduled in the future to come see you, he'll be excited and look forward to seeing you because he knows you're such a nice dentist. And then along with that, the mom, maybe her chief complaint was that her kid has 2 rows of teeth and she's really concerned. That happens all the time. We sit them down, we take a look, we say, this is normal, it's some ectopic teeth, no problem. Maybe we'll have to wiggle those teeth out. For now, we'll monitor. So to be able to tell someone we don't need to see you during the pandemic because of this would be a nice way for them to not have to take PTO, to then pick up her kid and then lose days of school. This could be a really nice way to provide a convenient service for them. Some other examples, I've had parents come in because they think their kid has an infection, and I take a look and it's just the operculum over the 6-year molar coming in. Things like this could maybe be transitioned to teledentistry. This service of teledentistry, it's never going to take away from our direct patient care. Patients will always need to come in. We always will have to clean their teeth by hand, fill their cavities, but this can enhance how our treatment is being done. We can add value for patients, provide more convenience, and we'll go through some more examples of that. Teledental services are among the Institute of Medicine and National Research Council's top recommendations for improving access to care for vulnerable populations, and that was in 2011. Research has shown that patients already use web-based devices for health needs because of ease of use and convenience. And recent studies on the use of telehealth services have shown that 70% of patients are comfortable communicating with their telehealth providers via text, email, or video in lieu of seeing them in person, and 76% of patients prioritize access to care over the needs for face-to-face interactions with their healthcare providers, according to the American Teledentistry Association. And patient attitudes surrounding services are important to consider. We live in a time of extreme convenience. Amazon Prime that can deliver things within a couple hours, Instacart grocery delivery, Netflix, you can think of any movie and have it ready immediately. The general public is used to and sometimes even expects more convenient options and services. There are, of course, some challenges to any service. One main one would be interpretation services. So you should consider whichever interpretation service you use, if it's a phone line, if it's a video chat, maybe finding a way that you could conference call them into the Zoom video or have them ready to be in touch with the patient. It does require adequate broadband support, so doing something like what we're doing right now comes with the risk of losing the call, frozen appointments, so be mindful of that. Patients may not own computers or smartphones, especially if you work in FQHCs like I do with the students. That's not readily available for everyone. And then depending on the method you choose to use, there could pose some security risks. Not everything is HIPAA compliant. And then technical literacy for both you and your patients. I feel very tech literate because I've grown up with technology, but in this crisis, I have had a learning curve with Zoom and Google Hangouts and WebEx and GoToMeetings. I've downloaded all the softwares and it's taken a little time to get used to. Teledentistry has already been implemented successfully in many environments in the US even before this crisis, and many have popped up since the crisis because people are very creative under pressure. And so we'll go through some of those examples. One example of Synchronous is the Teledentist, which is one of the companies that I am employed by. Again, they're not paying me to talk about them, but I thought it'd be nice to run through how their service works for patients. So I receive an alert on my phone or my computer that a patient has entered the waiting room, which is in a patient portal. And then I review their chief complaint, their medical history, and whether they have a third-party payer or have already paid. That's all taken care of before I get in there. After I feel comfortable starting the call, I initiate the video call on the VC Messenger, which is a software that's HIPAA compliant and available to the public. And then as long as I'm not in the public or near my family, it is secure. Same with the patient if they're not in public, it's HIPAA compliant. And then we have a discussion on whether or not they have a broken tooth or swelling. I can e-prescribe any necessary information to their pharmacy that they already already would have input information for. And then I can direct them to either go to the ER if it's severe swelling, or I can conference call in a customer service representative who then sends them to or connects them to a dentist in their area. Or if they're in network with Cigna, I can tell them to find a dentist in their network, because the teledentists are currently with Cigna. And then an asynchronous example is the Toothpick app, which is the other company that I work for. This is a store and forward method. So patients pay a fee for the service. They're partnered with Sonicare, so a lot of their marketing comes through that app. The patients are told that a dentist will respond to them within 24 hours. I receive an email stating that the patient has requested a report via a patient portal, which is again a secure, encrypted, HIPAA compliant form. I log in and I review their medical history, their chief complaint, and then the patient photos that they took, or the intraoral photos, because they are instructed to take 6 simple photos of different angles. And then I tag areas that I see as a concern, which you can see in this photo. The doctor tagged mild gum recession. And whether or not that's part of the patient's chief complaint, we tag anything that we see so that we can educate the patients if we see a broken tooth or a potential cavity. It's then, we can't always give a full diagnosis because we don't have an x-ray, but you can get a lot of information from these iPhone photos. We then give palliative care for their chief complaint and then educational advice. And then we advise them to follow up with the dentist, and we can tell them how urgently they need to. There are quite a few dental schools that have already implemented teledentistry. I had the opportunity to speak to the Western University of Health Sciences Dean for Community Partnerships and Access to Care, who was actually one of my professors, because this is the school I went to for dentistry. In 2018, they started using a software called Denticom, which I believe was created by one of their students. It's a HIPAA compliant web-based triage portal. So they use this in conjunction with their school-based oral health centers. They train nurses or other adults in the school district to screen if a child comes into the nurse's office with tooth pain. Maybe they see that there's an abscess. They go into the web-based triage portal, report it, and then clinicians at Western U are notified. They complete an assessment and then appoint the child as necessary, either to one of their school-based centers or to a pediatric dentist referral. They also use a hub and spoke model in their outreach department. So they have school-based health centers that are the hub, and then the spoke are mobile clinics that go out into other schools in the district or other sites. And then the students that are under the guidance of an attending gather data like charting, x-rays, etc., enter it into Axiom, and then to get them used to the teledentistry model, a clinical faculty back at the school or at the hub evaluate, diagnose, and then direct the care that's needed. In some cases, that might just say, looks good, go ahead and do a cleaning and fluoride. In some cases, they'll say, go ahead and put an interim therapeutic restoration, which, if you're not familiar with that, that is a caries stabilization technique. It's essentially a temporary where if they don't have the necessary equipment to do a definitive restoration, or if the child's behavior is uncooperative, they may just spoon excavate some decay, put some glass ionomer, and then reappoint them for a definitive restoration. And then in California, they use extended function dental assistants as well. So the dentist could be telling the assistant to place an ITR restoration also. And then they're appointed as necessary. Some other schools in response to the COVID-19 crisis, the University of North Carolina started a virtual helpline, and they direct patients to video conference calls and then connect them to specialists. And then our very own U of M pediatric dental clinic, they're using a mix of synchronous and asynchronous teledentistry. The patients will call, and then the residents will gather pertinent information and health history. And then the patients are directed to the HIPAA compliant, secure, web-based portal on the school's website. And I'll show you later what they're asked to gather for data, but they take some pictures, they enter all the information, and then the attending and the resident review the information, determine the next steps, whether it's a Zoom call or if they need to be seen in the clinic, or they offer advice. I also was told that the University of Minnesota TMD and oral surgery department are using Zoom calls and some teledentistry, oral surgery for post-ops, and then the TMD clinic is billing more for medical procedures. So Children's Dental Services is a large nonprofit in Minnesota that has school-based health clinics, Head Start centers, and rural locations as mobile clinics. And they're using the virtual dental home. They received a grant, the telehealth grant, in 2016. And then they adopted this virtual dental home model, which was created by Dr. Glassman at the University of the Pacific 6 years ago. So it's pretty well established. This model sends allied dental professionals like hygienists and dental therapists or advanced dental therapists out into the community. They treat patients at the top of their scope or the top of their license under the guidance of dentists. And this is, I'll show you a visual on the next screen how that looks. But the benefit of this is the necessary travel for patients is reduced, as they can decrease the number of appointments needed to complete their care, and it increases the number of patients that can be evaluated by the dentist. So this is the visual. It's similar to the asynchronous slide, where we have allied dental personnel on site taking in all of the data, putting it into the electronic health record, which at Children's Dental Services, they use Open Dental. The dentist is then off-site. It can be either synchronous or asynchronous, but from what I gathered, they do more synchronous visits. So they log in, they check all of the data, the x-rays, the intraoral photos. They then call the hygienist or therapist and tell them what they're seeing. They say, yep, ADT, please go ahead and place that filling that the patient is requesting, because that is within their license. Or they charge out a periodic exam and say, let's just see them in 6 months. Or if they determine that it's more complicated, maybe it needs some cross, they can then request that that patient is seen by the dentist back at their main home location. And in Minnesota, we already have collaborative agreements where dental therapists and dental hygienists are allowed to go out into the community and perform services within their scope without a dentist having to see the patient first without an exam. They're then referred back to the dentist to complete the comprehensive exam. But having a virtual dental home just exponentially expedites this, because we can complete exams. The dentist is monitoring all of these patients and then determining which ones really need to be seen by the dentist, while they can have their column of patients that they're seeing on site. At this point, you may be saying, this is great, I'm sold. Now tell me, what do I need to do to offer this to my patients? I'll tell you. So you must determine if your practice wants to offer this in the short term, or if you are looking to implement this more in the long term. Maybe you want to do both, but you just want to quickly get set up and then figure out your long-term solution later. In Minnesota, we still can't do business as usual until at least May 13th, so this could be useful for many of you in the next few weeks. You probably heard, and I will show proof, that the federal regulating body put out a statement stating that they will not penalize healthcare providers if there are HIPAA compliance issues, as long as they're acting in good faith. And many insurance companies are offering reimbursement right now for teledentistry services, although some are only temporary and only during the crisis. There are some insurance companies that are reimbursing for telephone calls alone without a visual component, which up to this point I haven't made mention of because it's not technically considered teledentistry by the normal definition. But in this crisis, there are certain companies that are reimbursing for telephone calls, and I'll go through that. Then you need to decide, are you going to offer these services for existing patients only or new patients? because there will be patients out there that are looking for a dentist in this crisis that don't have a dental home. So maybe you can be the hero in their time of need so they don't end up in the emergency room. If you do want to do this long term, you need to determine how you're going to include this into your normal workflow. Maybe you want to use this as a means to provide preventive measures, like asking your hygienist to call the patients and offer oral health instructions. Or maybe you have a satellite clinic and would like to help increase dental care options for underserved communities. Maybe you want to partner with dental therapists via a collaborative agreement and use more teledentistry. A lot of what I've said is so far, and what I will say is in relation to Minnesota's laws. I urge you to check your state regulation and reimbursement policies. The Center for Connected Health Policy is a good option. And hopefully at the end, I actually just received an email about an hour ago that breaks down all the states and what telehealth laws are out there right now. So I'll try to put that in the chat. Otherwise, I'll work with Dr. Peterson to get that out to you. And I did see that there's some people here from Canada. I'm sorry, I don't know much about Canada's laws right now, but I would just urge you to call your board of dentistry. And now you need to determine how you're going to offer these services. Your options include an optimized teledentistry system, which is an all-in-one HIPAA compliant software. These are already on the market. They're patient-tested services, so they might be more convenient. They may have staff training available from the company, and it will most likely be a better long-term option for you because the relaxed HIPAA regulations are only in effect during this crisis. A downside is most of these have a fee for the service. Many of them do have free trials or discounted services right now, but it can be tough to want to add in another fee when the economy is where it's at right now. So if you do want to just do available tools that are free and low cost and just get up and running for the short term, you may you want to just know that these could have some security risks associated with them, and we'll go through that too. One main benefit is that patients may already be familiar with these apps or systems, and there are many options for you. So an all-in-one system looks like this. It has an area where patients can fill out their registration forms, their informed consent. You can complete the messaging or the video within the system, and then they may have scheduling software included via an encrypted format. And then they may also include marketing materials for you to inform your patients that you're now offering teledentistry services. These are some examples. It's not an exhaustive list, and I'm not advertising for any of them. I just want to show you that you have a lot of tools, or you have a lot of available options. And know that some of them, but not all of them, will integrate with your electronic dental record, and it depends upon which software. I've heard, I can't remember which one, but one of them for sure integrates with Dentrix. I'm sorry, I don't have the answer to that, but do your research. And then if you want to just get going with available tools, the ADA states on their website that you can use FaceTime, Facebook Messenger, Skype, VC, Zoom, WebEx, and the list goes on for synchronous teledentistry. If you don't have remote access to your electronic dental record at home, you may want to look into a scheduling app like Calendly or Doodle. And what's nice about these is they both integrate with Zoom or GoToMeeting. So if you are using this, you can go into the calendar, list all times that you're available this week, send that to the patient. They can click what time works for them, and then a Zoom link is sent to both of you at that scheduled time. Zoom also does have an option for healthcare, but it is a paid service, and the free service will kick you off after 40 minutes. So just know that if you chose to go that route. The asynchronous formats, if you can have patients text you a photo, send you an email. You can use Facebook Messenger and Google Voice. One nice thing about Google Voice is if you don't want your patients to have your personal cell phone number, you can go into Google Voice and generate a new phone number. And then within the website, you can instant message and call each other, and then they can send photos there as well. The free service is not HIPAA compliant, but if you want to pay for the Google G Suite, that is. And then if you decide that you want to start seeing new patients, and if you're conducting your teledentistry from home, you do want to have a way to get an updated, or you want to get the medical history and all the forms, their insurance information. So you need to figure out how you're going to get that from them. Are they going to email that to you? Are you at your office? Are they going to fax it? Do you have a secure portal on your clinic's website? You also need to keep in mind that some of your existing patients, if you haven't seen them in a year or two, you'll want to get updated information from them. And then you are going to want to consider using a new informed consent with all of this, and I'll describe that more for you. And then you need to find a way to schedule a follow-up. If you have remote access to your EDR, you could do it that way. Maybe you have a skeleton staff that's helping you and you could direct them there. Or you could use the Calendly or Doodle app. And then you can give patients referrals as needed. And then for billing, if you have that remote access, you can bill the patient or their insurance. If you don't, and you are just going to charge a fee for the service, there is the Square app you can download, and you can collect payment and charge patients credit cards. And then after all of this, you need to document your encounter, and we'll go through the specifics of that. With that, if you have your remote access to their chart, you can easily document it there. If you don't, are you doing it on your computer? And then is it secure? Are you writing it on a piece of paper, which is fine as long as you can lock that up and make sure your family doesn't see it. So caution with all of these. You must tell the patient in any video call, if you're using the available tools, that this may not be a secure call. And if the patient understands that risk, then you can proceed with the virtual visit. And then know if you're asking patients to send you medical history, anything that's sensitive, photos, their email might not be secure, so as long as they're willing to take that risk. iPhone messages are also stored in the cloud, so even if you delete it off of your phone, it still may be accessible. Facebook Messenger and Gmail, if you're using Google Voice, I know that both Facebook and Gmail save my password, so if you are having patients email you things or you're chatting with them and you have a shared computer at home, your other family members could view that conversation if you don't log out. And really, you must ensure the same standard of care as in-person visits. So this even comes with your diagnosis. You can't always definitively diagnose everything, and you need to tell the patient that, and you need to document that the assessment is most likely to be this. And then make sure if you are seeing new patients that you confirm the new patient's identity and their date of birth at the start of the call. And then overall, even though the HIPAA laws are relaxed right now, it's not a free-for-all to just disregard everything we know about HIPAA. You do want to do your due diligence to make everything as secure as possible. So if you do decide to use Zoom, this is the toolbar of Zoom, and there's the security icon. You can click that once you're both in the room, lock the room, but just know that if your patient, if their internet connection fails and they leave the room, that they will be locked out until you unlock them and let them back in. So if you are going to move forward with this, you want to inform your patients of the available teledentistry services in your office. You want to collect the informed consent forms and updated medical histories. You then ask the patients to send you photos, or you schedule the virtual phone chat, and then plan for a follow-up or placing the patients on a wait list or refer them to specialists as necessary. And then you have to document everything and then bill your patients or their insurance. Or maybe if you're providing a fee for service, have them, you may want to collect the payment before the phone call. And this is a wordy slide. I have a couple wordy slides coming up, but I wanted to give you an example of some sample language of how you can advertise your service. This is also in that handout, so hopefully you all can get that. This is in the Virginia Health Catalyst. This is essentially saying, hey patients, we are now offering teledentistry. If you're interested, give us a call. We'll walk you through how to take photos, and we can give you some recommendations for treatment. And then you want to have a new informed consent. This one is nice because it's pretty all-encompassing. You, in some cases, may only be able to get verbal consent, but I would recommend maybe reading this and then writing in your note stating that the patient agreed to this. Best would be to have them sign everything, but this is acknowledging that they wish to receive teledentistry, that you may be asked to send photographs or other documentation. We'll try to provide as much information as we can. I understand I need to go to the ER if I'm having life-threatening swelling, and then I understand I am responsible for any payment resulting from this consultation. Any new form you use in your office, you may want to discuss with your lawyer, and then you also may want to check in with your malpractice insurance carrier. I checked in with mine. I went on the website. I have PPP, the Professional Protector Plan, and they had a note saying, as long as you are following the ADA guidelines, it's fine. Teledentistry, again, it's not changing your scope of practice, but they just may not have language surrounding that. So check in with them. And then some states require that you record any video that you have with the patient. You have to let them know if you are going to do that, and Minnesota does not require that. But check in with your state's requirements, or country if you're from Canada. And this one's even longer. This is on the ADA, and it's accessible in my handout also. This is basically saying that we understand the HIPAA regulations are loosened, that it's okay to use FaceTime, Facebook Messenger, Google Hangs, etc., but there could be a risk. This also states that you should not be using Facebook Live, Twitch, or TikTok, as popular as they may be, and I have not yet downloaded TikTok, but those are not meant for patient care. And then this is just proof from the US Department of Health and Human Services, the Office of Civil Rights, that truly HIPAA violations will not be penalized right now. This was released on March 17th. And then I wanted to draw attention to the last line, that the reason they loosened these regulations is because they are empowering medical providers to serve patients wherever they are. We are especially concerned about reaching those most at risk, including older persons and persons with disabilities. So they want you to do teledentistry. So next, if you are going to ask patients to use this service, you want to make sure you're obtaining quality patient data. This is also in my handout, tips for patients using a flashlight, a headlamp, your iPhone flash, and then how to position that phone. And a safety reminder, before you ask patients to stick their fingers in their mouth and take pictures, tell them to wash their hands. Don't touch any surfaces in between washing their hands and their mouth. Maybe it'd be better to ask a family member or quarantine buddy to take these photos for you. And then if you're using a self-timer or touching your phone, maybe you want to Lysol wipe the phone or the flashlight. So this is, again, included as part of that handout. You can share this whole document with your patients if you want a full series of photos, or you could just use the ones that you want. And I'll go through this kind of quickly. It's just kind of nice to see that with these smartphones, you actually can get pretty quality data and quality photos. This top photo, maybe you would ask them to take another one with a better light source. But you can ask for any shot that you might need, and then it tells them, like, tip your head slightly to the right. It's nice instructions to get what you need. And then this was the document I had mentioned from our pediatric department at the U. Dr. Sarvis gave me permission to share this. I thought this was a brilliant use of spoons to use as photo retractors. This could also work for adults. You might just need bigger spoons. But this is a nice full series of what you need. And then that front-facing photo would be nice if you're trying to screen for any swelling. So if you've gone through all this and you determine that your patient still does need to be seen in the clinic, the goal is to have all the information, explanations, payments, consent, etc., exchanged before the patient gets to the clinic. So teledentistry can help you with that. You also, when they come to the office, want to minimize the exposure risk, the amount of time they're in the office, how many people are in the office. You want to ask the patient to wait in the car and call when they arrive. Tell them when the operatory is ready. They go directly past the front desk and into the operatory. And then you already would have known, hopefully, what you need for your setup, so your assistants can be really efficient with the setup there. And then if you have a minor or a vulnerable patient and they have a caretaker or parent, maybe you just have them sign the consent and then go back out and wait in their car. Just know not all patients have cars. So if it's a nice day, maybe they could wait outside, but you might still, in Minnesota, who knows what the weather will be. So be mindful. And then you may want to stagger appointment times so you have less people in the clinic. If you've done a teledentistry call and determined that it's non-urgent and that it can wait, you want to put them on a wait list and then prioritize which patients need to be seen first when you do get back to business. You then can give patients palliative suggestions, discuss OHI, nutrition, and tobacco cessation, which all have CDT codes. Some insurances reimburse for them. I don't know which ones, but if you do want to code out OHI, for instance, that's a D1330. Just make the patient aware that there could be a fee for that service, so you don't want to charge them and then have them be angry. And then if it's a patient that you might not be able to see for a while, maybe they're higher risk, you might want to consider a prevention tool like a Prevident prescription. And then just, again, be mindful, oral hygiene and oral care might not be a priority with our patients right now. They're facing unemployment, childcare needs, homeschooling, illness of loved ones. And you actually may be a resource for them. You may want to have some information on a food bank or mental health services available. I saw in the news that the National Mental Health Hotline had an 891% increase, which is incredible. I'm not going to go through all of this. This is in my handouts also, but this is just a visual of everything I just talked about. You may want to come up with a similar workflow so that all of your staff can understand how this new service will work. And then the billing codes. This is the one I was talking about, had that broken link, so I apologize for that. You might want to take a picture of this, or you can Google search the ADA billing guidance. This is just showing that the two main teledentistry codes are what you are going to be reporting in addition to the codes up above. So you're most often going to be using either the screening, which probably won't get reimbursed, the limited exam code, which is most often going to be reimbursed, and then the reevaluation post-op codes. And then some insurances may reimburse for the case management or consultation with a medical healthcare professional, but not a lot of them. And then if you do find that coding and billing interim guidance, this is a snippet of what that looks like. They actually have 7 pages of all of the insurance companies that they have been in contact with. And this just shows you what they provide as a resource. They say what codes they're going to administer. They ask if they will cover that D9311, consult with a medical professional, and if there's any limitations, such as how often a patient can use teledentistry and code for D0140. One thing I don't have on here, but I noticed in this list that the Blue Cross Blue Shield of Massachusetts was the only one that had a note saying teledentistry must be patient initiated. So we can't call the patients and offer these services. It's the only one that I saw that said that. And this guide is being updated about once every 2 weeks. This particular one that I included or that I've seen is updated April 14th. And then this is just showing from the Delta Dental website the proof that they are in fact covering the D0140 limited exams and that they will cover them on through 2020. So that's nice that we have some time. I can imagine that a lot of these insurance companies will also extend that period. This is just continuing to grow, and as more people offer teledentistry, I think the insurance companies will follow and reimburse. One note too, Health Partners is also reimbursing for limited exams and the D0170 for all forms of teledentistry. And it's possible that these companies will reimburse for telephone calls. I don't have proof of that. So if you're curious, you could give them a call. You also can backdate a lot of these. I know for a fact MA, and we'll get into that, but many of them you can backdate to like March 17th or whenever they put their memo out. I was told that Health Partners did furlough many of their employees, including in their claims department. So the reimbursements might be slow and it might be hard to get a hold of them, but Delta has not, and they sound like they're easier to get a hold of. So this is from the Minnesota Department of Human Services. This is a list of all of the codes that are allowable under teledentistry services. A lot of these will be used in kind of that virtual dental home model or asynchronous style, where your assistant or hygienist or DT are taking the x-rays, and then under the provision of a dentist, this is happening, and then we are coding the exams as the dentist. But it's nice to see what Minnesota allows already. And then this is a note for anyone that is an MA provider or an MA credentialed dentist. If you want to start offering teledentistry, you need to make sure you fill out this provider assurance statement before you can get reimbursed. This is the only one I've seen this for, is for MA through the Department of Human Services. And then one note for any FQHCs, you do not need to file with HRSA requesting an expanded service, because this is not an independent service, it's within your scope. So then this is that proof that the Minnesota Department of Human Services will reimburse for telephone calls alone. They don't have to have a visual component, but they also will cover teledentistry with, it's basically telephone or televideo visits. And then again, you can backdate any teledentistry services you have offered through MA back to March 17th. And then I just found this on Friday. I wanted to let anyone that know that works in a nonprofit, an FQHC, or a higher education institution, that within the CARES Act, the FCC is offering funds, and they will provide immediate support to fully fund telecommunications services and any devices necessary for nonprofits. And that was sent out April 21st. So get that money if you are in one of those clinics. And then the documentation that you need in order to be reimbursed, this is the only written form that I found from the Minnesota Department of Human Services, again for MA, but I think this is a good guide for any of the insurers. So you want to say the type of service that you provided, the time it began and the time it ended, a description of the provider's basis for determining that teledentistry is appropriate, so basically the medical necessity for this visit, the mode of transmission that the teledentistry service, so what did you use, and then the location of the originating site, and then the distance site, so patient's home, and then dentist address on file, or home address, or dental clinic. And then you might want to consider adding COVID-19 screening questions also. We are facing a new normal in dentistry after all of this. Patients might be scared to go back to normal. They might be scared to come into your clinic. I liked this quote that came from our U of M president, Joan Gable. It's likely that our post-COVID-19 lives will begin as a sunrise rather than an abrupt flip of a light switch. And that applies to us in dentistry too. So how could this look with teledentistry? Maybe you have an extra operatory or a consult room where you actually have a column of appointments that are dedicated to teledentistry, and you maybe have trained staff like your assistant that goes in and answers the phone call, takes down information, triages, comes and grabs you once you're done with that filling, and then you start your new patient visit. Maybe you offer all new patients the option of, do you want to come in person, or do you want to start by doing video chat with your dentist and do an exam that way? Because again, we're going to have precious chair time that we're going to need to figure out and prioritize. Maybe you already have a satellite clinic, or you're interested in having more satellite clinics to increase your access to care. And you could also expand into long-term healthcare facilities, group homes, schools, or rural sites using the allied dental professionals in a collaborative agreement. And then, as I mentioned previously, I think this could be a great option for dental phobic patients, both children and adults. According to the Minnesota Dental Association, in the midst of this crisis, we're actually allowed to mail out any clear aligners, dentures for high-risk patients, night guards, or mouth guards. So maybe in the beginning, anything that can be virtual could be, because how many times have you had a patient sit down for any of these and they pop in that clear aligner and it's perfect and they're in and out in a couple minutes? does that have to be seen in person, or could we do that over video, because you can see pretty clearly whether that's going to snap in or not. And then you can say, actually, yeah, I do need you to come in. Some ideas. And you know, this could happen again. I hope not, but there are news reports that we could be seeing a spike next year of COVID. There could be natural disasters like the fires in California or hurricanes. We get blizzards in Minnesota, so maybe instead of shutting the office down for a day, we could then offer teledentistry for those patients that are scheduled. And then I just wanted to go through a sample virtual consult, what this could look like for you. This is going to be pretty similar to what you're maybe already doing in your office after you see a new patient and you sit them down in a consult room and go through all of their images and do some education. This is not a real patient. This is my friend Gretchen. She gave me permission to use her photo. These are not her x-rays. I just grabbed these off of Google. And because you're all smart, you can tell that they're not the same teeth even. I just needed something. So let's say Gretchen came in March 11th as a limited exam because she was worried about her wisdom teeth and was wondering if they needed to come out. So we took a pano. We only had her scheduled for a half hour. We said, yep, we think you should get your wisdom teeth out. Here's a referral. While you're here, do you want to get started on some data collection? Because we would love to see you back for a cleaning. And she said, yes, I really want to get a cleaning. Let's do it. So we took all these intraoral photos. My assistant did this for me. And then we scheduled her back, telling her we didn't have time to do the cleaning and exam that day. We scheduled her back on March 30th. But then what happened? We couldn't see her. So when she first came in, she wasn't in any pain, but all of a sudden she's calling me and saying, I'm suddenly having some pain when I'm biting on hard things like pistachios on my lower left, my second, or my furthest back tooth that I can feel. And I happened to, in her chart, note that, yeah, 19 was looking like it might need a crown. I saw the flattened cusps, I saw the craze lines, the margination on this amalgam. I already was going to test this tooth and recommend a crown. And now she's telling me that she's having some pain on biting, a little bit of cold sensitivity, but nothing that's keeping her up at night. It's more just with some really cold water. So I went through all of this and she was so excited. No one has ever shown her what these teeth look like. What a nice service to be able to see this up close and personal. And then I said, would you like me to connect you with my front desk staff and give you the fees so that there's no surprises? And she said she would love that. I also used this time to show her the calculus on her bite wings and say, while you're at home, maybe you could start flossing and get into that habit. So I think this could be a way for you to offer some virtual consults for your patients, and they're going to enjoy that convenience of not having to come back multiple times to your office. One thing I wanted to mention is the way that I did this was on Zoom, and I shared the screen. So I find Zoom is pretty easy. Again, you might want to consider getting Zoom for healthcare professionals. That's HIPAA compliant, but this was a nice way to just be able to share that screen. If I had had remote dental access to my EDR like Dentrix, it would have been maybe a little bit easier. Okay, so we're almost done here, but one thing, this is a study from the Health Policy Institute of almost 15,000 Americans that responded. 77% of them said they plan to visit the dentist within the next year, but only 37% of them actually visited us. And why is that? Cost is one main thing. We're not gonna be able to take away the cost of dentistry, but teledentistry could help reduce the costs. And then almost a quarter of Americans say they don't come because they're scared of us. So what better way than teledentistry to get to know someone, build that rapport, that trust. They're in the comfort of their own home. They're happy. Maybe their dog is on their lap. They're feeling comfortable. They get to know you. They see that you're happy and smiling and compassionate and want to help them. And then you can ask, when you do come into our clinic, how can we make your visit less scary if you're dental phobic? Is it the drill? Do we need to put you in the quiet room so you don't hear the other drills? You can really get that information and have patients look forward maybe to coming in, or at least feel a little more comfortable. And then another big one was inconvenient location or time. maybe through this crisis, or maybe in the future, you start opening some evenings or weekends where you do teledentistry visits for patients that can't easily take time off of work, or again, the school-age children. And then I thought this was just interesting to compare how Minnesotans compare to the rest of the country. We are 6% more anxious than the US average. Is it because our roads are icy and it's scary to drive? I don't know. But we did also have a lot harder time finding a dentist. Also, these studies were in 2015, so these could be a little different now. But we were 28%, or trouble finding a dentist, 28% versus 15%. We do have a lot of rural areas, but this is where teledentistry could really help fill that gap with access to care issues, sending out allied dental professionals. 28% of Minnesotans don't have dental insurance, according to the Minnesota Department of Health. So 28% is huge. How can we bring dentistry to them and help? So we need to find the opportunity from the tragedy. Teledentistry is a cutting-edge means of delivering care, especially during our current crisis. Synchronous and asynchronous modalities can be quickly and easily utilized. Each office must decide if and how they will implement long-term following their state and legislature and ADA guidance. And we're facing a new normal. Dentistry is part of the future. It already exists. It's just going to continue to grow. And whether or not you decide to incorporate teledentistry into your practice, I think your patients are going to start asking about it. So, something to think about. Here's my references and my email, as well as my plant babies. They've been my coworkers. I thought they needed a little attention. So thank you all so much for joining me. We'll get to questions here. I wanted to give my email too. I'm happy to help with any resources, or if I don't get to all the questions tonight, please reach out to me. Okay. So the questions we have, can you please explain PH2O? I don't know too much about that app. I just kind of did some initial search on it. What the website made it sound like is you are monitoring the saliva acidity. So the patients are ordering a litmus test from that company, and they're testing their saliva, and then the litmus paper will actually change colors based on how or what the pH is in their mouth. Then they take a picture of it and send it. It gets stored in the app and then shared with their dentist. So I don't know too much about how that works, and I'm not here to necessarily advertise for any of them, but I thought that was just an interesting mobile health option. And then please comment on other modes of remote patient care. My office has had a lot of success assisting our patients with original instructional videos on our YouTube channel. Temporary crowns issued during these extended periods of office closure. It's made myself and our team feel good to be a presence in our patients' lives during this difficult time, which is great. I think that's, wonderful idea. I would say that particular example, I don't know if it's considered remote patient care, unless you're talking about remote, like asynchronous going out. If it's just that remote patient care modality, that's really more like a Holter monitor or that sleep apnea at-home test. So it's gathering data and then transmitted back to the dentist or the doctor, and then they're using that data to make a diagnosis. So hopefully that helped answer that question. But I'm gonna look at that YouTube video. Under a virtual dental home, as Children's Dental Services uses, is it really legal to charge for a periodic exam when the dentist has not seen the teeth in person? Yes, it is legal. So that is, like I said, an established model from University of the Pacific, and maybe you had asked that before I got to all the legislature, but according to the Minnesota Department of Health website, they say as long as the images, the x-rays, the intraoral photos are diagnostic. You have to use your own professional discretion. It's not just, okay, we got them and go for it. It's, is it clear? You can then direct the dental personnel to retake it, or if you don't really feel like you can come up with an accurate diagnosis, you can then ask them to come back. But this is legal in Minnesota. I don't know about other states, so check with your state boards. And then, can I only use a telephone call with my patient and use the D0140 code? So yes, according to at least the Minnesota Department of Health, anyone that's an MA provider, the MA is for sure reimbursing telephone calls alone without that visual component. It's possible, I think Delta and Health Partners might be, but I don't for sure have an answer. I wish I did, but that'd be something you could call those insurance companies. Those are the only ones that I am aware of, but you can check with all of the third-party payers. And then, can ADTs do periodic exams through teledentistry and likely have those reimbursed? Yes, I believe so, because periodic exams are within the ADT's scope. I know that ADTs for sure can do limited exams. I'm not necessarily a billing specialist. This is just from the research and the data that I have gathered. So it could be something that you want to check in with the Minnesota Board of Dentistry. They're really great at getting back to you really quickly. Even as I was putting this presentation together, they got back really quickly with any questions I had. But I do believe, because it's within their scope, that they can do a periodic exam. Don't quote me, I know for sure the dentist can. So, and then, do you know if dental hygiene codes will continue as a service, Prophy code after 513? So Prophy code 1110 SRP. So I personally do not know what will be allowed. I mean, dentistry will continue at some point. I think maybe you're asking whether or not we can do those codes after the the peacetime order is up. I think it might be more that it's going to be a phase in where we're not doing aerosol generating procedures. Maybe it's going to be Prophy with just hand scaling. Again, I'm not an expert on that. I don't know if anyone really knows yet. So sorry if I can't quite answer that. Do you ever have issues with not feeling comfortable prescribing meds to patients who insist on it, antibiotics or narcotics? Yes, I am personally pretty stingy on narcotics unless it's really needed, because the research shows that that combination therapy of ibuprofen and Tylenol is the best for dental pain post-op procedures. Through the teledentist, we don't prescribe any narcotics, and what I read was, according to the DEA, if you do feel like a patient needs narcotics and you're working via teledentistry, you have to document the medical necessity. They recommend it being an established patient, not a new patient. And it has to be a video, synchronous. It can't be asynchronous if you're prescribing narcotics. So that's your own discretion. Patients who insist on it with antibiotics, and any time a patient tries to tell me how to treat them, I just, if I don't feel comfortable with it, I just say, you know, this is what research proves. I'm backed by science. This is what the ADA says. I cannot legally give this to you. I mean, it's just kind of holding your ground on that. So doing it through teledentistry is all your discretion. You want to make sure you're not letting patients abuse the system either. If they're calling you every week asking for an antibiotic, at some point you might say, you know what, let's get you in and see if this is really what's going on. So, and then, is there available training to get familiarized with the various softwares? I believe each software, if you're doing like the all-in-one optimized systems, they will have their own training. I think some even offer like a free trial, or they'll offer you kind of a demo. And then one thing I forgot to mention, the University of Michigan's dental school website actually has a really nice form that talks about how to use Zoom. If you do decide to use Zoom, it's a nice way to educate patients, and you can get a little more familiar with that. If you are wanting to use those available tools, I would also ask your friends to test it with you, so that you look like you know what you're doing before you get on with any of the patients. But I can't necessarily speak to each individual optimized system. I didn't have the time to dive deep into any one of them. I just wanted to make it known that they exist. And then fee reimbursement time-based or only, is fee reimbursement time-based or only procedure-based? Fee reimbursement is procedure-based. You just have to document the time that it took. So something might be really quick and easy and only take you 30 seconds, but you'll, it's more, I shouldn't say just 30 seconds. It's not just answering a question, it's is there a medical necessity and is there a valid reason for why you are charging this procedure. And then Sheila helped answer DDS and, or is this, I don't think it's a question, I think it's a statement. DDS and ADT can submit and get reimbursed for D0140. I have a feeling maybe that's Dr. Riggs, so I would trust that. And then where on the resource guide is the template for patient taking at-home photos? So on that resource guide, the first link that I put, because I think it's the most helpful, was the Virginia Health Catalyst. And then I wrote what is in there, or what, like they offer documentation, advice, etc. And then for convenience, I put the photo guide for patients. So whether you click that link or find it within the Virginia Health Catalyst, it was created by a doctor that works for Teledent. So I think that's a really great resource to offer your patients. And then, this is great. Anyone on the Zoom can reach out to Linda Mayton, Dental Policy Director for Minnesota Medicaid, with MHCP questions. That's great, thank you. And then another thing too, if anyone has, this is, everything is so fluid right now. I created this PowerPoint in the last week. Things may have even changed since I wrote this down. I did my best to try to get the most up-to-date information for all of you. But if I misspoke or you have information, please let me know, email me. Or if you know of any other helpful resources, I'm interested in learning more about any other teledentistry programs in the country too, or in Canada. So yes, thank you. So Linda, Dr. Mayton, it's linda.m.mayton, M-A-Y-T-A-N, at state.mn.us. Thank you. And then, what type of light are you using to illuminate your face tonight? I think it's a soft light. I don't know if this is, we did testing earlier because I was behind a bright light, so I don't know if it was good or bad lighting. That's all the questions that are here.